Good afternoon and welcome. My name is Nick Davies and I'm Programme Director here at the Institute for Government. On behalf of the Institute for Government and the Productivity Institute, thank you very much for joining us for the 7th edition of our Productivity Pitches series, with today's focus being welfare. Last month, the government published its spending plans for the rest of this Parliament, and it was a spending review that was very much centred around the theme of productivity. Indeed, the whole first chapter of the spending review is titled Productive and Agile State. And the government pledged to operate more efficiently at a lower cost to the taxpayer while delivering high quality outcomes. Well, if that was the aim, then this is exactly the series that the government should be listening to, because Productivity Pitches highlights outstanding examples of innovation from across the public sector, identifying key improvements and lessons that can be shared more widely. And today we have three more fantastic case studies. So first up, we will have Richard Clifton from the Shaw Trust, who will talk through their individual placement and support programme and the innovative contracting model being used by the West London Alliance to fund it. Our second presentation will be Kevin Donaghy from Belfast City Council on labour market partnerships, a programme in which they identify persistent vacancies in the city and then run workshops to train people on the skills needed to fill those roles. And finally, we will have Eileen Broderick and Sarah Gamble from Islington Council to discuss a new programme that identifies people that are eligible for pension credit but not yet claiming it, and then contacts them to encourage uptake. Each presentation will last 10 minutes, and then there will be 10 minutes of questions. If you are watching in person, please raise your hand and I'm happy to take a question from you. And if you're watching online, you can already start submitting questions now using the Slido Q&A function. Right, without further ado, I'm going to hand over to our first speaker, and that's Richard Clifton.
Thank you very much. As was introduced, I'm Richard Clifton from the Shaw Trust. We're a national charity supporting people into employment. We very much look at different ways that we can improve productivity. So I think I'll take you through some of what we've been up to. I think the first question that was posed to us was very much what was the actual problem? For obvious reasons, we've all seen the rise in numbers in economic inactivity, particularly around West London. That's an area we've been working to support that for a number of years. But the other problems within that is how we actually address it. So we've had multiple income streams that have come in, both at a local level and a national level, which has created quite a confusing picture for residents, having different programmes run at different times, a different eligibility. And that in itself has led to inefficiencies. It has reduced engagement from local residents actually getting involved with programmes or the right programme that's appropriate for them. It's not necessarily maximised the use of the resource that's out there and the funding that's available. And it does lead to people not necessarily getting the support they need when they need it. So what do we do to go about sort of solving the problem? We started piloting and learning from some of the work that we're already doing in West London and work very closely with the West London Alliance and the 7 boroughs within there. We have been running the Work and Health programme that's just running down at the moment for a number of years, and we did launch Work Well within the area. But what we noticed with that was that actually there was a better way that we can engage with people and start joining up some of this funding stream. West London Alliance were quite brave. They came up with a plan of a different way that they could commission this. Through a competitive tendering round that we were successful in winning. But actually what they managed to do through their commissioning solution was to draw together both the funding streams for what now is the Connect to Work that government is rolling out via local authorities and Work Well, but also commission it in such a way that they can add in additional funding streams and make a more effective way of joining everything together without having the duplication. Well, the first bits of that was when the Trailblazers came out, we were able to actually build into a network of support, an MSK Trailblazer supporting people in the community to engage. And it also allowed us to do that quickly. So within 6 weeks, we could actually move from having it agreed how we would do it to actually launching the programme. So it was very effective. And the main bit that I think has had the biggest impact is having a single front door. A single front door that allows residents and also other support workers within the area to be able to go to one point to refer somebody across or express interest in being supported, that then allows them to get onto the right programme at the right time. What that really looks like in reality is, as you'd expect, a digital solution, but of it is not just digital. It's about actually being integrated into the local communities. So although we do have a digital front door, we have a physical front door as well. People can talk to us, and referral agencies and all the networks we work with within West London can also encourage people to get involved. That then means that we can do a very early triage to see what's appropriate for that individual. It doesn't have to be a programme that we're running or funded by WLA. It may be other activities that are happening within the local authority or within the local area. We can get them onto the right support that they actually need. So that might be other organisations running drug and alcohol support. It may be the National Career Service. There's a whole host of other activities that are there that can be engaged. Well, the key bits for us, though, is integration in the community. So what this has also allowed us to do is actually work within GP surgeries. Actually, in 5 now in West London, we're actually based and seen as part of the support team within that GP surgery. So actually a GP can refer to the programme as an intervention for that person and run it alongside any clinical interventions that are happening, which actually means that we can then work together to join up the best solution for the individual. So the impact this has had, we moved over with Connect to Work going live 2 months ago. Over the last 2 months, we've seen 1,600 expressions of interest that have come through that single front door. That's against a profile of around 300 starts that we're expecting on the Connect to Work and Work Well programmes, but all of those people can be directed and supported by what's appropriate for them at the time that's appropriate for them as well. We've also engaged and involved local voluntary and community sector, actually as part of the supply chain, in some cases directly contracted, in others just aligning services so we're all working together. The individual placement and support approach that we use, and it's a core element of Connect to Work, has also had some startling sort of impacts for people and individuals. 44% of the people that go onto the programme actually move into sustained employment against the original target of 40%. It also only takes, on average, 3 months for somebody to move into employment. So it moves really quickly and captures their enthusiasm at the point that they've identified that they want support, actually while they're active and want to do something, picking up and moving quickly is really important. 73% of people sustained in their work after 13 weeks, 38 after 26 weeks. And we still then support people who drop out to then move them back in wherever possible. Also, we got average salaries of around £32,000. These aren't minimum salary jobs. These are good work, and that's what we strive to do, is move people into good work. The other thing is that 73% of people who found employment showed improvement in their well-being as well. And even 63% of those who didn't showed improvement. The vast majority either maintained their well-being or improved it. So it was very positive for them to be engaged. And from a financial point of view, we recently released a report that showed that our IPS in primary care participants, for every £1 spent, we were actually seeing a benefit of £2.43 for every £1 spent during the first year. That's just on the benefit side. So in fact, over a number of years, that can raise to as much as £9 for every £1 spent. The other impact is the real partnership. And the commissioning and the way that we work with the local commissioner is really important. And we do strive to make sure that we work very closely, not just with WLA, but all the boroughs within that. But it is about having a true partnership and not a transactional contract. Problem with transactional contract is they're great in year one, but actually as everything changes around you, actually it may not be the best way going forward. Having a partnership where we can share risk, we can trial new ways of working, and we can actually look at different approaches that we can take. The other thing of being a charity is that actual fact on contracting, any surplus we make, we will reinvest back into the activities we do. We're just about to pilot in West London a care leavers programme using the IPS principles, and we're totally funding that out of the charity of the surpluses that we've got from running the contracts within West London. So no additional funding needed, but we're going to support a number of people who have experienced the care system. Thank you. Last slide, so that's good. I think as far as can this be replicated, it definitely can. I did actually write at one point, hell yes, when I was doing this, but thought absolutely was more appropriate. But I do think that actually looking at the way we procure things in the first place is really important. Don't box yourself into a transactional contract. Look at a broad partnership and how that can develop over time. Also, very much be brave. If you're a commissioner, be a little bit brave. Actually, you're going to have to share some of the risk, but the benefits you get from that are tenfold, and it is really important. We've already started doing this in other areas of the country. So in Somerset, we're doing it actually within children's services. So we've got now an award-winning partnership down there of looking at different ways we can support people into children's homes, into therapeutic education, and support them through the system. So it's not just about welfare. It can be applied to other areas, but it definitely works for welfare. So in summary, yes, it can be done, and I hope that helps.
Thank you very much. You said on the last slide that people need to be brave. Who needs to be brave, and what does being brave entail?
So being brave, it's commissioners that need to be brave, and I think sometimes we very much get stuck into, particularly if you work with procurement teams, you must have very strict KPIs and everything else that are really locked in for the length of a contract. Be brave and actually go, but I want some manoeuvrability in this. Yes, still have the KPIs. I'm not saying you shouldn't have those, but actually have it so you can annually review them, you can update them, you can change them. Or actually say, this is a contract we're going to run for now, but we know in 3 years' time we might have to drop something else in. Give that variability in. West London personally went out and said this was a partnership over the long term to support that could go on up to 10 years and give them the ability to put in extra things. That's brave to get, particularly if you're in local government, you get councillors and cabinet officers to actually sign that off. But actually, if you've got the evidence there and it's proved it works, that's the way to do it.
Thank you. I'm going to open up to questions from the audience. First, in person. See if there are any hands. If not, I've got a couple of questions. Go to the gentleman there. Thank you very much. If you could wait for the microphone to come to you.
Thanks, Dan Hiley from the Institute for Government. It sounds like you've got a really great partnership with the local authorities you work with. The way you described it also sounds like you work in partnership with lots of other organisations. How have you found it kind of sharing information, sharing data across those boundaries? And is there anything that's made that easier for you?
Yes, it is always a challenge because you always get into sharing information. But it is actually looking at different ways that you can work. So actually working in GP surgeries in the NHS, our staff have honorary contracts that they've actually set up, which then allows them to access systems and be able to share at a very local level information. So it does mean in a GP surgery, we can actually tell the doctor what we're doing and they can give us headlines of what the clinical direction is. We don't get into personal detail, we get the information we need. I think that's really important. I think within the partnership, we were very clear at what information at very contracting we were going to be able to, but we always have that challenge. We then have a very responsive legal team within our side and within the councils and try and sort it out. A lot of the time it's just, let's just sit down and work down what is it we actually need. Don't overdo it, just have the information you need. You can normally get agreement.
We've got a question online about the data sharing agreements as well. Part of that was how long did it take to set those agreements up? And I actually had a question about your agreement with the West London Alliance, because clearly people do the transactional relationships because it's generally easier and quicker to do. So how long did it take to write the contract with WLA?
So the WLA contract probably only took us 2 months to actually finalise in reality. That's because we have been working with them a long time and we had those open conversations in the first place. I think the important bit is have the open conversations, don't get straight in with the legal teams. Have them sat there so they're hearing the conversation, but then get them to work together to make that happen. Don't just go to a legal team and say, well, I need to do this, because they're going to be risk averse, they're going to lock everything down. Have the conversation first.
I've got a question here from Declan Dudley, who's asked, really interested to know how you hid the wiring of the various streams and programmes running behind your single front door. And can you track individuals through, for example, connect to work versus work well? And does this impact on your ability to evaluate?
So there's quite a lot in there. Yes. Right. Hiding the wiring. One of the main things that we committed to was actually putting in a single customer management system that sees people through, that all the programmes run through. We manage and run that, and we work with an organisation to make sure that that is totally secure. Something we've developed with them over a long period of time. That actually means we can then share the whole journey of somebody. If they swap programmes or they've been on programmes before, we don't have to ask the same questions again of the same people. That's really important. That also means that we can actually look at the whole journey of working through. The other thing is WLA are working really closely with the ICBs to look at actually can we get anonymised data for these people as well, so then we can cross-check both of them. So for evaluation, we can have both sides of the information.
And there's a question here about what barriers were there, if any, to integrating with GP surgeries, and are there any kind of learning for future programs? Because it's something we hear a lot, particularly from local authorities when talking about kind of integrating with the NHS in general, that it's just incredibly hard to collaborate with them. You've got to give them the win, and I think that's the important bit. I think we very much went in Frank, it's no good me going into a GP surgery. It's building it up on a very local level. And actually having people that you get the buy-in at the top, but you need to go in and show a GP what the benefits are and actually demonstrate it. So quite a lot of the time, we started very lightly going in and working with certain groups of people and built it up over time. It isn't a quick fix. You have to build trust. And the main thing is build trust, but give feedback. The one thing that GPs never hear is actually that person never came back to them. Well, why didn't they come back to them? Actually, it's because now they're happily in work and settled. That's why they don't need a sick note. That's why they're not coming back through the door. But actually giving them the feedback is what builds the trust. Then they can see it as a win. One of the other things that we hear is often a kind of barrier to better integration is siloed funding flows. Can you say a bit more about kind of how the money flows from you kind of out to other potential providers, be those voluntary sector or potentially statutory providers? So
I think it starts back with WLA, and the way they've set it up is it flows very simply through to us. We then have the ability on the contract to contract out to who is the most appropriate to do it. We set up very simple systems. We do not go for over-bureaucratic systems, but we work very much the same way we expect to it. We work in partnership with those local organisations. If we can have simple contracts with somebody, we will. If they're running an end-to-end service and they have to have all the data sharing agreements we do, then we will just cascade down what we've done. So we've done all the work and we make it really simple then on the front line. And we manage all of that for WLA so they don't have to worry about it. So it doesn't end up being the council legal team, it's my team's responsibility, and we've got the experience to be able to pull that together.
And there's some of the services that you're delivering directly yourself.
Yes.
So is there, I guess the fear might be that there's a sort of financial incentive for you to kind of hoard as much of the work for yourselves rather than passing it on to others?
I suppose it's the advantage of being a charity.
Yeah.
What would I hoard it for? Because I'm going to actually use it for something else in the local community. We're not about dividends, we're about actually giving it back to the community. So I think it's who you work with as well. You've got to trust that organisation. I'm not saying that private companies can't offer the same and actually you can lock that into the contract, that they have to reinvest whatever over a certain level that they make. So you can do that in commercial contracts as well. Obviously, with the charity, you have the advantage. I have no shareholders. My shareholders are the local community.
On that kind of community point, so someone's asked, how involved were members of the community, especially groups who use the service, in developing these innovations and evaluating them?
So we work a lot with people within the local community and gain their feedback. And I have an R&D team that actually goes out and does sessions with groups of people that have been through the programme, and we look at how we can improve it. We also go out into the community and talk to not just end users, but also community organisations to actually get everybody's feedback to develop what it is that we're trying to do. That's part of how we work. We want to be working with everybody. We don't want to duplicate things that are there. We generally deliver the elements that nobody else is delivering. If it is already there, I'd much rather support them to continue delivering good work.
And one final question, because it's something we're thinking about a lot at the moment, which is has or potentially how will reorganisation of NHS, kind of abolition, merging of ICBs, etc., impact on the programme and the relationships you have?
Because they're at a local level, I don't think it's going to have that much impact. But we do work with a number of the ICBs, and genuinely, we're just going to keep the dialogue open. I don't see many changes because most of it is about merger. We're not getting rid of them, we're just bringing them together. So it could actually make it simpler in some respects because there might be less people, less different organisations to work with. But in actual fact, we're not going to see any of it disappear.
Richard, thank you very much.
Thank you.
Next up, we have Kevin Donaghy from Belfast City Council.
Thank you, Nick. I suppose I am here to talk about a transition in the labour market that we have seen in Northern Ireland over the last 5 years and how we have had to change delivery to suit that change in labour market. Councils in Northern Ireland don't have a statutory responsibility for employability and skills. So we sort of sit outside the whole system, which gives us a bit of freedom in a lot of what we do. But I suppose the background of this was a major programme, Steps to Success, similar to programmes you've had here. Our major labour market programme, funded by the Department for Communities, ran for about 7 years, value of about 7.1 million every year. 3 prime contractors, partnership delivery across 3 areas of Northern Ireland, and Northern Ireland is not big. It's a population of about 1.9 million. It was in the main mandatory, so people that were unemployed were put to that programme when they hit the trigger points or the trigger periods. Other people in the ESA, work-related activity group, could be mandated at a point in time, but that was a longer period of time for them, and there was a lot of certain conditions around that. And then it was voluntary. If you were on the ESA group, you could do it voluntarily. The figures, 93% of people were mandated to go onto it. 3% were JSA people who entered it early, so they hadn't hit their mandatory point, but they decided to go onto it anyway. And 4% were voluntary. So people were forced onto the programme in a way. The outcome in that programme was 29% into employment. Sounds quite high, but sustained employment dropped off significantly to 20% of those 29% sustained their employment for 6 months or more. What has happened following that is in Northern Ireland now we have next to no unemployment. We are sitting about 1.8% unemployed. It's basically zero unemployment. UK, I think, is about 4.6. So a different dynamic was needed. You just couldn't mandate people who weren't there to do a programme. So the programme then changed to our Department for Communities, looked for a successor, and it created these labour market partnerships. Labour market partnerships are a local entity. There's 11 of them. There's 11 councils across Northern Ireland, and each one has its own oversight board with a regional oversight board made up of government departments. So it is up to each council to pick and choose who they want to sit on their oversight board. We get a list of who should be on it, but then we can pick additional people to join it. So in Belfast, we would add people like the Harbour Authority, one of the major employers in the city, one of the major landowners in the city. So they come on board. We took on board the Health and Social Care Trust, the biggest employer in the city. But we have government departments, we have CIB, we have the Federation of Small Business, we have interested community groups and organisations sitting on it. It was looking to improve the labour outcomes of each area by this collaborative approach. So it was those people who sit on the labour market partnership were looking and telling us, well, this is the issues I'm facing or we're facing as employers. Can we do something about it if we have some funding to do it? So what each labour market partnership does is we do a deep dive strategic assessment into what is the actual issues in the area. And that looks at everything from unemployment, economic inactivity, school leavers, qualification levels, people coming through school, what will that all look like in a future 5 to 10 years' time. From that, we devise a fully costed action plan, which is submitted to the regional LNP, and they agree it. And then it's my role as Labour Market Partnership Manager to deliver against that. We have a budget of 5.5 million. It's the same money that was funding Steps to Success, except we've got 1.5 million less because we're all in a time of crisis and it's a top slice 20% and we just have to make do with that. As I say, we have no statutory responsibility for skills and employability in the city, so it gives us a bit of an opportunity to sit outside and be a neutral broker in the activities that we do and give us a little bit of scope to try and test things. Have a go at it, suck it and see if you want it for another way. Let's try something out. With a bit of luck, if it works, we can go back to our government department and say, you know what, you should change your programme. Your programmes have something missing within them. If you add this to it, that might actually give you better outcomes. Just a bit about and reinforcing that sort of idea of targeting economic inactivity. Figures are a wee bit out of date, but if you look at it, 21.8% of people in Belfast are economically inactive. That's not including students. If you add students to that, it goes to 31%. And actually will be higher because as of 2022, 15,000 more students came into our city because a university moved its campus from our neighbouring council into ours. So we have that figure now added on to our economic inactivity. The issue is we have to get these people back into our labour market. And if you look at the figures, only 4 or 3% of them were volunteering for programmes to actually support. So how do we get more people back into the labour market? We have massive opportunities, massive job vacancies within the city, but people can't actually get towards them or we can't fill the employers' needs. That figure there, almost 7,000 people out of those figures want to work. So they're economically inactive, they could fit in within for health reasons, looking after the family, they could be one of those groups, but they want to work. So what do we do? And one of our solutions was an employability academy model. And it's not something new, but something we've been doing for a while, beyond labour market partnerships, but it's something that's having a great success for us. And we have replicated that across our neighbouring councils, on all councils, because they have looked to us. Belfast is the biggest council by population. They have looked to us for support around what do you do and what help can we do. The diagram on that sort of bottom right is a very complicated view of what an employment academy is. It's all the bells and whistles that you need to do it right. But the overarching things that I would pick out from it is academies are only triggered when there's job demand. And that job demand is multiple job demand. It is not 1 or 2 jobs. It is an employer coming with 6, 8, 10 jobs, or multiple employers coming with 1, 2, or 3 jobs. When you amalgamate up, you get 10 jobs. There's no point in training 15 people for 1 job. That's really what you don't want to be doing. It's always a guaranteed interview. We don't ask for guaranteed jobs. Our employment legislation doesn't allow us to do that, so it's always a guaranteed interview, and it's always delivered in partnership. The employers look to fill vacancies. They know what skills they need. They know what the type of people they're looking, so they're involved throughout this. They start and end the process of the Employment Academy. Screening's a big part of this. We look to do soft interviews where softer skills are needed, but more psychometric testing if it is higher level skills. What we don't want to be doing, and we're a political organisation, we are council driven, our bosses are councillors, is we don't want to set people up to fail. We want to get the right people to the right jobs. We also don't want to set up our employers to fail, because if we send them the wrong people and they don't stay with them, they'll never come back to us and give us that opportunity again. Always benefit assured, and that's one thing we really have great inroads with our benefits people, is everything we do now, we'll get a benefit assured. It used to be we could do it for 2 weeks, but then we said, look, we have a 4-week programme now, would you benefit assure that? Yeah, no bother. We're running up to 16 weeks at the minute. We're pushing it if we ask them for anything more at the minute, but we're having success, and we'll have more conversations with them, but they're seeing the outcomes, particularly with the people that are getting the jobs. All additional costs are added into that, so if you need the support costs around childcare, travel, whatever, they're built into the delivery of the programme. And a big thing is 6 months post-programme support. That's both for people who get jobs and for people who don't get jobs. Not everybody will be successful in the interview process. So our delivery agents, and we don't deliver this ourselves, it's a bit of a procurement thing that we do with our community and voluntary sector, is to get that out. 90% in completion rates, 75% into employment, and 75% sustained employment. That's the sort of figures we're talking. We in Belfast have some academies that run at 90 plus into employment rates because of the process that we put in. An external evaluation generally about the LMP model showed the strong localisation and adaptability. It was flexible and locally responsive. Each local area knew what their local employers wanted and needed. So it was adaptable, skill solutions that met the employer's needs and quickly did respond to employer demand. The LMPs are a value for money outcome compared to Northern Ireland benchmarks and GB benchmarks, and it's an average employment rate of 52%. So if you take the 29% that this programme was funding previously, we have added another 20% plus on top of that, if not more, because not all of the funding that all of the LMPs goes towards employment academies. We can do other things like jobs fairs. So this is a global figure across all of the spend. But as we get more and more sophisticated around this, we'll have more and more outcomes in terms of employability.
1 minute.
And I think that's me.
Perfect. Thank you.
I could get it right.
Can I just start by asking you to explain, for those who don't know, what kind of the difference is between those who are unemployed and economically inactive?
Unemployed, if you're unemployed, you are technically on a benefit regime that will, you get your benefits by job seeking. So you have a criteria that you must seek for a job, and your benefits is given to you on that basis. If you're economically inactive, you're within the age range of the workforce, but you're not seeking work for reasons such as health reasons, caring reasons, retired, or students. So you don't necessarily have to take work, and you may still get benefits, and you're deemed to be within this economically inactive group.
Thank you. I want to pick up on the kind of the costs, because as you said, you're spending roughly 20% less, but getting outcomes maybe twice as good. What are you spending less on? What were you spending money on before that you're not now?
I wouldn't want to answer that because we didn't have the purse strings prior to the programme, but a prime contractor model with multiple partners where potentially the prime contractor may be taking a top slice off the budget that they're getting before anything is delivered is probably one of the reasons that I would think that the costs were a lot higher in that delivery model than they would have been for what we were trying to do.
Thank you. I'm going to open up to questions from the audience. First, in person. Someone at the front.
Hi, I'm Stuart Hoddinott, Institute for Government. How are you finding people to bring into the workshops? What's your process for going out and letting them know this actually exists?
It's a partnership approach. Belfast City Council obviously has a traction across the city, so anything we do in terms of our social media has massive traction. People pick up on it very, very quickly. But we rely on our delivery agents and the community and voluntary sector to do this. We are not out knocking doors. I'm not a delivery person. I don't go and deliver any of these programs. So our delivery agents, and they're primarily in the voluntary and community sector, because those are people working with the hardest to reach and the hardest to access. So that sort of model, we have a stakeholder network that we established a few years ago with 400 organisations on it, 600 to 700 individuals from those organisations and individuals on their own right. So we start to pump out that information about, we have an employment academy going to start in X, Y, or Z. If you're interested, come along. Our delivery agents are working on other government programmes, other programmes, and dealing with people who don't fit in. The Shared Prosperity Programme, for example, has very tight criteria in Northern Ireland about who can access it. So people don't fit into that. So our programmes can help those people who don't fit those sorts of programmes. And one of the things that we're very clear is we never take people off a programme to go onto our programme. So if you're on a funded government programme, you can stay on that programme. You can do our programme alongside it without having to lose the support you're getting there as well. So those little bits of added value things actually help people who wouldn't necessarily come forward for other programmes.
And do you know what the volume of people that you're supporting now versus the predecessor programme was volume? Is it roughly the same?
If you added all of the people, we're probably seeing more, but that's across programmes the likes of job fairs, other activities, but certainly we would probably be seeing more individuals across all of the 11 councils and all of the range of activities that we're doing. The thing about it is we're seeing more of the 4% and 3% people that weren't volunteering for the Steps to Success programme. We're seeing a lot more of them than that programme ever would have seen.
I've got a question here. To what extent do you think that some of the problems, for example, school leaver and care leaver levels of economic inactivity, could be prevented at a lesser cost by the school and care system themselves?
It's one we've been looking at, and certainly we're looking at a programme at the minute around a bridging programme for young homeless people to see if there's something missing in that system, that young people that are moving out of care are becoming the economic and inactive of the future. So we're trying to understand, and the funding at the NNP does allow us to do that sort of thing, to say, well, pick apart this journey of a young person and find out, well, what actually is all of their steps and why from that step to that step they're now not where they should be and are now coming that neat long-term economically inactive or the long-term economically active of the future. It's a difficult one where we don't have a lot of statutory responsibility in those systems. I suppose councils here in England and so on would have a lot more input into those systems and some of the regimes and activities that they have to deliver. We don't, but we very rely much on our partnership approach to see if we can do little bits and then hopefully mainstream that in the future.
Can you say a bit more about the identification of the gaps, in particular the employers coming towards you? So you mentioned quite a lot of government employers. And with the private sector, do the jobs have to be permanent jobs? Do they have to be of a certain length?
It's something I suppose we as a council, and again it goes back to the fact that we are a council and we are run by councillors, is something that we very, very much clear about. We will not run academies for 0-hour contract jobs. That's not something we can do. We cannot be seen to be maybe taking people off benefits to put them onto a 0-hour contract, and within a month that contract is pulled and they're gone. That flips around and they go back to their councillor and speak to their councillor, and it comes back to us. So we really do want to concentrate. It's part of our agenda in the council. We have an inclusive growth agenda. We want to get good jobs for people that last a long time. We do pick and choose. There's industries where we don't really want to get engaged with at the minute. Hospitality is one of them. There's massive demand for it, But again, a lot of it is to do with how the employers recruit, how the employers pay people, what the sort of terms and conditions of those contracts are. So we do very much look to what the employer, who the employer is and what their sort of contract, and we will say that if it's a 0-hour contract, we'll not deal with it. And but generally, it's a full range of jobs from the high-tech industry right through to management roles as well.
You mentioned high-tech there. How far ahead are you looking when you're doing your labour market analysis? Because obviously the kind of the skills that are needed now might not be the skills that are needed in a year, 5 years, certainly not in 20 years potentially.
Well, certainly it's something as part of the strategic assessment. We're looking at that. We're trying to future-proof that. We engage things like Lightcast and all of those sorts of systems that help to try to picture that future. Talking to the employers is the real bit. Is what, and for a lot of employers, it's what's now. It's not necessarily 5-10 years down. We have a business need now because we have a contract or we're doing something in that world. If we can get over that hurdle, then we can look to future-proof that. I suppose it's a bigger picture for the government department in terms of making sure that our education and training system is looking future-proof to say, why are we continuing to train people in pure plumbing when retrofit is a skill that's going to be of the future so we'd link in very closely with our government departments around that to sort of try and engage on it. A lot of the times we're reacting to the here and now. Is employers have a massive need for staff. We have 0 unemployment and we have huge economic inactivity. They have massive job vacancies and they need them filled. So we try and do that. But certainly future looking is something that we want to do as well.
And have there been any challenges building those relationships with the private sector? Has it been easier with some than others, or generally is the demand so great that they're coming to you?
It's changing, and we're starting to see more employers coming to us. I think it was a case of some employers, particularly in the tech world, didn't really believe that we could do it. You know, they were looking for graduates coming out after 3-4 years. It didn't really matter what qualification they had, because they were going to retrain them anyway. So they were picking people up who had degrees in philosophy and all of these sorts of things and retraining them. We said, give us a go at this, one try, give us 16 potential job vacancies, non-traditional people, no degrees, let us have a go. So a foresight employer went, yeah, okay. 16 people finished that, 14 started work with that company, and 2 people didn't because they had personal issues. That employer now comes back, and that employer is talking to other employers saying, there's a way to get a new pathway that we never thought of before, because we were blinkered on this, we all have to have degrees in our tech world. No, there's a billion people out there who have no degree and who could hack any computer in any place. Give them an opportunity, and that's what happened.
And just finally, if you were speaking to someone else who was setting up a similar scheme, what would be your kind of key bits of advice to them? What are the key things you've learned?
In terms of labour market partnerships, you need to get all the people around the table. You know, you need to get all of the voices heard and let everybody's voice be heard so that everybody can see that there is a role for them. If people are talking and nothing's happening for them, then they'll leave the picture. Employment academies, I think they're a win-win. I just think you just need to get a good delivery agent, a good understanding of what people want and the employer wants, and a good employer to take a risk to say, I'll have a go at this, especially in things that are not easily done and not traditional. We could run these for hospitality all day long, but in the world of tech and higher level skills, if you can get a real employer who wants to take an opportunity, not just for corporate social responsibility or social value, but as a genuine need to get more people into their business, let something like an employment academy have a go, and it'll prove successful as long as they're bought into it as well and start from the start and finish at the end.
Kevin Donaghy, thank you very much. Right, our third presentation is going to come from Eileen Broderick and Sarah Gamble from Islington Council, who are hopefully about to join us remotely.
Hello, good afternoon. I'm Eileen and I'll be presenting today with my colleague Sarah. Okay, so we'll go to the first slide, Sarah, please. Volume up. Okay, so in Islington, we know statistically wise that we're one of the 6 most deprived London boroughs. We're aware that 1 in 10 residents over the age of 65. We have residents 1 in 10 over the age of 65. A third of the over 65s are living in income deprived households, and we've got over 400 pensioners that are not receiving pension credit when they could be entitled to pension credit. Now, Sarah and I are in a well-established sort of benefits team sitting within Islington Council, where we sit in a sort of a department that's not aligned to housing, adult social care or children's social care. It's more of a corporate run department. So our sort of scope and our reach within the council is wide. And it's a team called IMAX, Income Maximisation, and it's very, very well established. We have a daily advice line, which is run from 9:30 to 4:30 weekdays. We have a very easy, accessible way of referring into our team through a generic email, claim@islington.gov. We have a direct line via our social care and the health assessment tool. So where a social worker, a health practitioner, or somebody doing any kind of care assessment or any kind of health within the borough is able to access our team via a drop down on the assessment tool. We also have access to that assessment tool ourselves. So that helps us when we do our benefit take up. We're linked in with our energy team, and they have an enormous reach within the borough. They go out and they actively make sure that each household has as much kind of energy saving devices possible in the household. They give advice on sort of energy saving tips, the best providers of our energy providers. We have a direct referral in through our voluntary organisations. We've got an organisation in Islington called Help on Your Doorstep. They actively go out and they door knock on the large estates in Islington, and they talk to people who answer the door, and they talk through any issues, are able to signpost them, and they signpost a lot of residents through to us via that route. We have hubs in the borough. We have hubs in libraries. We have a north, central, south hub. It's a very small borough. And we have got links in with those hubs. We've got links in with our Age UK social prescribers. So within the GPs in Islington, where they're able to, our GPs are able to refer to us, and all our kind of services in Islington are able to refer to us using any of those methods, and just picking up the phone and talking to us and making a referral or popping it into our inbox if they don't have the assessment tools that they're able to refer to us through. So it's kind of interesting to think that we still, although we feel that our reach is good, it's still limited. We're still aware that there's using data that we're able to identify pensioners who are missing out, and pensioners are a group of people that until recently, if they weren't getting pension credit, the flip-flopping of the government, weren't able to access the winter fuel allowance. So they particularly felt it hard to sort of cope over the winter months, yet still with a clear sort of cut entitlement, because pension credit is a fairly straightforward benefit to claim and to do an assessment on. They were still missing out on claiming their full entitlement. So we thought that if we use the data-led approach, we might get some success in drawing these people who are failing to claim the benefits that they should be getting, and help them obviously to deal with their sort of household incomes and pay for their bills and deal with the cost of living crisis as we have now. So next, what did we do? So this was the problem that we had identified. We thought our reach was great, but obviously still lacking. And what more could we do? There are still people not either accessing our service or don't know about our service. So what did we do? So we used the policy and practice. They have a LIFT dashboard, which is the data that we have from our housing benefit and council tax support residents, and it's put in a very easy, accessible form. And we're able to look at that, and we're able to identify and bespoke certain kind of areas if we want to break down the information on that dashboard into things like certain areas in the borough. If we can do it that way, we can pick up age appropriate benefits and things like that. So for pension credit, which is the benefit we were looking at, we were able to identify those who were missing out and sent a letter to those households. And in that letter, we were able to give a link to the government application, and also give a name of an officer in the team and an extension number of the officer in the team who would be helping them to make the claim for that benefit if they wanted to, or to advise them on that benefit and other benefits. After sending the letter, we were, where we had telephone contact, we were able to follow that up with telephone contact. Because we're an integrated team within a local authority, we have access, sort of as mentioned before, to the social care assessments. So we're able to, where we have a name of an individual, a resident, we're able to access the records to see whether any social care assessments have been done for that individual. We're able to access any sort of housing benefit or council tax support that individual may have applied for. So when making a telephone contact with someone, we often have quite good background of their situation, both their sort of benefit situation and possibly their other situations based on if they're on the social care assessment tool, and we're able to have a very informed conversation with them, and it's halfway there and the sort of tell them once kind of program, really, which we haven't quite mastered yet, but it's we have to ask them fewer questions because a lot of the information we have at our fingertips, really. So the dedicated officer would maintain contact with the person, do a benefit assessment, carry out a benefit assessment, identify any benefits that they may be entitled to, talk to them about that, whether they were able in a position of whether they wanted to apply, and support them with making that application. When talking to a resident, it's important to know the full kind of situation of the household. So often, although we're talking to that identified resident, we're often talking about other members of the household. So whether it's a partner, whether it's a sort of adult son or daughter, or anybody else that may be living with them, a carer that may be living with them. So we often are able to give a very sort of full benefit assessment for that household, and it could be identifying things like carers allowance, if there are a carer in the household, or attendance allowance if someone needs some sort of additional care needs. And the way in which our team sort of work with a resident is that we keep them with one officer because it feels much some sort of relationship is built up, some sort of trust relationship is built up, because occasionally people do have issues around contacting the council. If they have had issues with the council in the past, they may have some suspicion about working with the council. So I think that gives some sort of reassurance. And we keep a case open, so we casework them and kind of pretty much handhold the resident through their benefit journey until the end, until all kind of outcomes are known, and the whole sort of gamut of the household in terms of benefits has been established and has been sort of concluded. So any arrears that may be due or anything like that are sort of paid. And using the data, we're able to run reports to sort of evaluate the impact of the campaign, but also look at other trends and things like that may arise through sort of changes. Right. Okay. So next slide, Sarah. I think it's over to you, Sarah, isn't it?
I'm not sure if you can hear me, but you've got about 1 minute left.
Oh, sorry. Over to you, Sarah.
Oh, right. Okay. So we've run 4 successful pension credit campaigns, and we're about to launch the 5th one. Each campaign has built on the lessons learned from previous ones. There's been a strong take-up rate amongst the households we've contacted. So out of 1,166, 57% of those have received a successful pension credit claim. And these results provide strong evidence that our proactive approach is working well. So as well as the financial support given to Islington's older residents, there are other benefits these campaigns have had, such as increasing well-being, which comes with being more financially secure. There is also a saving to the council as care costs are reduced. So some of the stats. So we've increased older people's income by 2.8 million from pension credit alone. During our casework with each individual, we have identified other benefits such as attendance allowance, carers allowance and housing benefit, which amounts to 152,000 a year. In addition, being awarded pension credit unlocks access to other passported benefits such as the previous cost of living payment and warm home discount, winter fuel payment, which is estimated to be worth around 120,000. And then as well as the financial and wellbeing benefits for residents, the campaigns help reduce the demand on social care by making carers more financially resilient. So 13 carers were awarded pension credit, and this can prevent potential residential care admissions. The average cost of a care package is 42,000. So the estimated savings to the council is 545,000, which is the cost of preventing a year of residential care. And helping carers financially can delay or prevent care breakdowns, which saves money for the council and supports families. So I'm not sure if we've got any time left, but Eileen?
Yeah, okay. So this was just a case study from one of the earlier campaigns, and what it highlights really is that this is a couple that on first sort of glance they wouldn't be entitled to pension credit. However, after speaking to one of our officers, we were aware that they were getting attendance allowance, and this is a fairly complicated sort of interaction of how on sort of first glance someone may not be entitled to a benefit, but when you look at the whole sort of the household and what's happening in the household, so they were getting pension, they were getting attendance allowance, so they could then get a carer's premium, severe disability premium too. So actually, it's just how, there's more to it, I suppose, really. This is a pretty sort of an amazing result, but actually it's not unusual. It's not an unusual result, and actually, so I would say that. Conversations need to be had with households in order to find out the full sort of circumstances. Sorry, I've rushed that, but yeah.
Let's go to questions from the audience quickly. I might see if there's anyone in person in the audience who would like to ask a question. If not, I have plenty of questions coming in online. So the first question is, are central government broadly supportive of this work? I'm interested to know if they're actively promoting it, even though it's drawing from council funds, and is there anything more they could do to support it?
I think they have been supporting it, especially around the winter fuel allowance sort of debacle, in terms of the fact that I think they wrote to all pensioners, or they did some sort of campaign. Did they do a television campaign? I think they might have done, in order to get people to claim pension credit, so that they could access the winter fuel allowance. But I don't think we've heard anything since then, really. Yeah.
And can I ask on the data? So you've clearly got quite a lot of the data that you need, that the council holds anyway, that you need in order to identify people. Is there any other data that's held by kind of national government or NHS or other bodies that would be helpful if you could access it?
I think it's difficult with NHS because we have two sort of large hospitals sort of flanking Islington, and we work sort of a lot with those. So we've got the Whittington and we've got UCH in the south. And what we find from their kind of referrals and their interaction with the hospitals is often there's kind of cross boundary. So say in the north, we've got Haringey, a lot of those are Haringey kind of patients, and in the south, they might be Camden patients. So we are kind of constrained by sort of Islington boundaries and Islington postcodes in that respect too. Yeah, but
And I've got a related question here online. So they've asked, how has the transfer to universal credit affected this programme? The question also said that they've heard from various local authorities that because universal credit is a centrally distributed fund, it has reduced the visibility of vulnerable households in particular areas. Has that been your experience as well?
Yeah, we've lost a lot of data with universal credit as well. Although, you know, certain teams do have access to the DWP data. What we've had to do with universal credit is we've had to sort of rely more on our residents coming to us for support, and then relying on our residents to upload, say, their universal credit statements to us so that we can see them. We can see the breakdown, and we've got access that way. So yeah, they've got to be sort of fairly tech savvy. So for particular rollout at the moment for the ESA cohort that being rolled out over to universal credit at the moment, I anticipate that there will be issues because they may struggle more than other groups in terms of doing things like that, and therefore struggle to access services like ours, because we can help with things like discretionary housing payments and things like that too, but it does rely on the resident being able to upload their statement so that we can look and see what the shortfalls are and things like that.
We've got a related question here, which is how are you working with those who are financially excluded, and I'd add potentially kind of technologically excluded? For example, do you help them set up bank accounts? Is there any more kind of proactive support that you can provide to them?
We don't help them set up bank accounts, but we are really linked in very well with our voluntary organisations, so we may be able to get them to help with those kind of things. And we've got kind of now in Islington, we've got what's called connectors. So we've got people in our kind of contact team. So the first contact that a resident will have with the council who are getting more sort of, the scope of their work is increasing to do more sort of immediate and hands-on work with our residents as they need it, as they present. Yeah.
Another question from online, which is, which groups of people are typically underclaiming pension credit the most? And for example, does it vary with deprivation?
Would you know that, Sarah?
Yeah.
Is it going to be... I wonder, is it, because we were talking about this and we wondered whether, what we found out in our sort of our campaigns is that when we have conversations with people who haven't claimed pension credit, it's often because they're not known to the council. So they haven't come to us for other services. They may just be your bog standard council taxpayer, and they've had no need to come to us and things like that. So it could be, bizarrely, people are more self-reliant, and then further down their sort of life journey need more services. So we have been able to link them in as we go along with like care services and other forms of support that the council could provide or voluntary organisations could provide.
Mm. Yeah, because I think we did find that like some people who weren't claiming pension credit was because they were getting like a state pension and they just didn't think they would qualify, or they had like modest savings and again they didn't think they would qualify.
Thank you. Another question from online, which is, do you know the proportion of people who haven't applied for the benefit even after having received the letter? And have you been able to research why they might still not apply for a benefit that they're eligible for?
I think, some of the reasons why, people gave us was just like, kind of maybe they'd received like an overpayment before of a benefit, and so they just didn't want to apply. Sometimes it was like the drip effect. So like we've run 4 campaigns so far. So although we might not like have, they might not claim on the first time or the second time, but by the third time they would make the claim. And so sometimes it's just like a time thing. Statistics, so it was like 57% success rate. So 33% are not claiming. But each time we do the campaign, we capture more of those people who didn't claim on the previous round.
Thank you. And then just one final question from me. So you spoke a bit about the kind of the obvious motivation for the programme. Can you say kind of practically where the idea came from and what it took to get the programme off the ground? What did it require to get kind of the approval internally to get the programme started?
I think it's interesting. I think it happened during kind of COVID times. Our first campaign started when we were kind of all at home, and then a few of us started coming into the office and things like that. So So it was probably around the time when the government gave the enhancements to universal credit. I don't know if you remember how many years ago that was. I always think I've missed a year with COVID, but so they gave a £20 uplift to people on universal credit. Was that weekly or monthly? Now I think we've completely forgotten, but I think it was we realised that pensioners were a group of people that were probably missing out. And so we've got support because we've moved. We're a team because we're not aligned to sort of a particular directorate. We actually got moved. And I've got to say we got support from our directors in the new directorate, and they were able to see it, possibly because of the work that sits within that directorate. So they do sort of the social care assessment and financial assessments. It's more financial based, actually. So it's an interesting question because, we're in a directorate that's more, concerned with finances to the council. So they see the value in terms of, residents being able to, be financially more resilient.
Brilliant.
Yeah, so I think that was it.
On that note, Eileen, Sarah, thank you very much. Right, finally, I'm going to be joined on stage by Professor Melanie Jones. Melanie, we've had an awful lot there, 3 quite different examples. What are your kind of key takeaways from what you've heard?
Okay, yes, so thanks very much, obviously, for the invitation to join you. I actually lead the Wales Forum of the Productivity Institute. Many of those issues that we talked about in terms of sort of an ageing population, health of the population, high levels of inactivity, they are critical to Wales. And actually, when we talk about productivity, we're often talking about national productivity. And within that, we consider the sort of public sector productivity, but I don't think very much we've talked about welfare. So it's a great opportunity for me to learn, really, about what I would think of as kind of bottom-up innovations. So while different, I think there are some things that are common across the different case studies that we've had today. And actually, some of those, I think, resonate much more broadly with things I've heard about challenges. So the first thing I think I would highlight, which probably is most obvious when we talked about the pensions, was kind of the accessibility, the kind of complexity of the environment when we talk about welfare, and that as a barrier to access. And that barrier to access isn't equal either. So clearly when we're talking about welfare, we're talking about supporting some of the most vulnerable in society, and they're actually the exact individuals that perhaps have the greatest challenges around education levels, around health, that are a barrier to access. So clearly what we've learned today is that it's not sufficient to have a service. You also have to go out and proactively promote that service, recruit those people that it's designed to be for. But I also think there's a broader challenge around just the complexity of welfare and how we can try and simplify that to make it effective, but also understandable by the public. Because you could have a great welfare system, but if people aren't using it, it's not doing what it's intended to achieve. Related to that, then, what I heard very much was about sort of coordination and partnership. So I think one of the ways to improve accessibility is about thinking about the person and then having this sort of one-stop shop to direct multiple benefits. So you're not actually benefit-specific services, then you're thinking about the individual and bringing the different range of benefits to that individual. But we also heard much more about partnership and coordination as a way of making the service more effective as well. So you can then reduce duplication, you can provide complementary activities around sort of health and work was one example, but also thinking about reaching out. So we had great examples about thinking about employers, where the destination is, what do employers actually need, and working back, working with GPs, they have the health expertise. So it's recognizing that whatever service you provide, there are people with additional expertise, and that can be really beneficial. I think the key thing for me is when we think about these exciting innovations is to what extent they can be more widespread. And I think there's one thing that I was really impressed about today, which was the use of data. So I saw evidence-informed action. I saw people use data as part of the actual scheme, but I also heard a lot of what I would say statistics and evaluation. And that to me as an academic means that you're on a much better footing in terms of trying to convince others that your service is effective. It's not just you know, personal stories that you can, but it's actually hard figures around increases in employability, and we're always interested in changes in outcomes. So the use of data there, but also I think it really challenges us to think about what we're trying to measure, what the outcome of those services is designed to be. I think in terms of some things like employability, I heard really good examples where sustainability of employability was mentioned. You know, earnings, job quality, it's not just about getting someone into work. You know, it's clearly going to be much more effective if you can get someone permanently into work, and the way to do that is by getting job quality higher. But it also made me think much more, particularly the pension example, where it's not an obvious saving for the government. It is actually expenditure for the government. So essentially we're talking about transfer of resources, really. But that can still have longer term implications that are beneficial because we're transferring resources to those people who need them. And I think at some point there was mention of sort of prevention. I think it was actually in a question around sort of where should the intervention happen. And so we're not talking about necessarily saving the government in the short run, but what I think we're talking about is improving things like housing. I think there was examples around health, you know, well-being, such that there's lower demand on kind of services. And obviously there was the good example around, I think, carers and reducing demand for services. So I think getting us to think about what we're trying to achieve. And then clearly the big question is then, once you've got the data to prove it's effective, what is the best mechanism to disseminate that? And I think there was a really interesting example where you actually fed back to a sort of national government. And for me, the kind of critical questions are around whether it's dissemination of best practice. So are these schemes best held locally? And I heard very good examples where you're working with local employers where it really needs to be local. So essentially another spatial area might adopt your practice, or the extent to which these practices are run well and can actually be scaled up. So I think that's a really difficult question. And the final thing that I think I found really interesting is listening to these, it's what is the incentive? So I guess who is actually instigating this? Is it groups of individuals? You know, is it individuals with a particular passion to provide a better quality service locally? Or are there the frameworks that actually encourage that kind of innovation from the top? And therefore, you would expect that people want to replicate where they hear examples of good practice.
I want to pick up on that final point on kind of incentives and also your other point on financial flows, and particularly when we're thinking about kind of societal productivity. And the challenge that you often hear is that the organisation that spends the money is very often not the organisation to whom the savings accrue to. And particularly we often hear in public services that kind of poverty is a big driver of kind of acute demand for public services, and kind of benefits expenditure is one of the kind of key levers that the government has to alleviate poverty. But clearly the kind of the politics and kind of the spending demands on DWP in particular is to try and reduce your benefit spending as much as possible. How do you think we can move to a kind of more grown-up, kind of holistic conversation about kind of allocative efficiency?
I think it's obviously much easier for me to say than actually do. But I think what do we know? We know that early intervention is effective. So thinking about, you know, in an education system, thinking about very early on, thinking about a recently unemployed individual versus somebody that's been sort of out of work for a long time. It's always easy, and that's why your timeliness, I think, comments really matter. Intervention early, and for me, it's about investment so that we reduce our long-term problems. So in terms of thinking about the outlook, that's why I'm thinking about sustainability of employment. It's not just about quick fixes, it's about thinking about the long term and how we get around that sort of, health versus education. You're right, it's not my problem, is going to be about coordination. I think it's back to coordination, but perhaps at a higher level within government.
Yeah, because I mean, I was struck by one of the things you were struck by, the importance of relationships throughout all of this, both between the different organisations working together, but also building the relationship with the people who are actually using the service as well. And it's kind of something that frequently comes up in these discussions. And I guess the question is, what can central government do to kind of enable more of that relationship building and relationship sustaining at a local level?
No, a difficult question, but I think the feedback, I think by definition, the people on the ground realise the issues, can see the interventions, and it's about listening, having a platform by which that information does get fed back and disseminated then out, but also that I'm sure there are barriers and challenges that you experience by some of the structural incentive systems that are sort of top down, and it's about also responding and them trying to make them more flexible. We hear a lot about the kind of short-term funding, whereas you really need to think about the long term if you're going to have the kind of sustainable change that I think we're going to need.
Great. Well, on that note, I'm going to bring this discussion to an end. As mentioned at the start, this is the 7th in our quarterly series, and the 8th event is actually going to pick up on an issue we've just been discussing, which is how do you disseminate kind of productivity enhancing innovations that are happening in one place to another. So that's due to take place towards the end of the year, and we'll have the details on our website shortly. Until then, thank you to all of our speakers, to the Productivity Institute for supporting the event series, and to all those who've watched live or are listening back later. Thank you very much.